Clean the wound thoroughly using infusion solution and flush out any small particles of dirt. Disinfect the wound and surrounding area with a disinfectant spray. Wash and disinfect your hands. Put on sterile gloves. To ensure that all material inside the packages remains sterile, all items should be provided by an assistant. Cover the area around the wound with an operating cloth. Prepare a table with all the necessary materials. Local anesthesia. Have your assistant provide you with a syringe and a size 1 cannula. Draw the local anesthetic into the syringe. Change the cannula to the size 12. With the cannula pointing upwards, carefully push any remaining air out. Disinfect the area to be anesthetized once again. Fanning out from either end of the wound, inject around 1 milliliter of local anesthetic into the surrounding tissues. In case of larger wounds, make further punctures on either side, injecting parallel to the edges of the wound. Wait 2 to 5 minutes before testing the anesthetic by carefully pinching around the edges of the wound using the tweezers. Skin suture. Grasp the needle approximately 2/3 of the way up from the tip using the needle holder. The first stitch should be placed in the middle of the wound. Approximately 5 millimeters from the edge of the wound, guide the needle vertically through the skin and pull the thread through to leave about 5 centimeter length on the other side. Use the forceps to lift the opposing edge of the wound. Apply slight tension lengthwise if any misalignment occurs. Pierce the needle from the inside to the outside and pull the thread through. Using a cross knot for durability, tie the knot close to the wound and cut the ends to about 1 centimeter long. Carry on in the same way with the preceding stitches, placing them in the middle between the existing stitches and/or wound ends. The wound edges must not turn in on themselves. If this occurs, use surgical tweezers to correct them. Skin staples. Prepare to place the first staple in the middle of the wound. Use surgical forceps to grasp both wound edges and pinch them together. The wound edges should be slightly rolled outwards. Hold the skin stapler near the forceps over the middle of the wound and press the trigger. Carry on in the same way, placing the following staples in the middle between existing staples and/or wound poles. It is quite normal during this process for skin bulges to occur. Plaster strips for small tension-free wounds. For a secure adhesion, the wound and surroundings must be clean and dry. Place a plaster strip at 90-degree angle across one side of the middle of the wound. Gently pull the other side of the wound towards it. Then pass the strip over and secure it into place. For successive strips, proceed in the same way, placing the following strips in the middle between existing strips and/or wound ends. To increase the durability, place 2 more strips parallel to the wound over the top of the existing strips.